Good evening, Pharm D colleagues. If the second year Pharm D, third year, or the fourth year students are, listening to this, it is very good. At least the fifth year and the sixth year should be aware of this, and this is the ultimate aim of Pharm D. Individualized, uh, customized, comprehensive therapy plan with clear therapeutic goals is what we are looking at. Say a multivitamin that contains broad amounts of multiple vitamins, multiple minerals, multiple amino acids, or natural extracts is a pre-planned formulation. But what the patient may require is an individualized plan like that. Based on the body weight, based on the height, based on the BMI, based on the various other conditions, we will have to ensure that the pharmaceutical care plan is made in a very proper manner, and it is implemented and executed, right? So this pharmaceutical care plan is a complete documentation process where we understand about the patient's past, the present conditions, the medication history, and everything, the drug related problems. Now, how do we document all these things using the pharmaceutical care plan? There are various formats that are available, but we need to understand the principle behind this documentation, right? Documentation provides, it becomes a legal thing, and it gives you an efficient communication. Everybody can understand what is written. It has got references we can understand. It is used as a backup for the billing, and so various methods or protocols or formats we call are available to document this pharmaceutical care plan. Now, PWDT, FARM, the most utilized SOAP, Subjective Objective Assessment Plan, an expanded SOAP, Subjective Objective Assessment Plan, goals, monitoring, education of the patient, all those things, or a HOAP, the History Observation Assessment Plan, HOA and P. So that can also be a format. Or subjective objective assessment plan, then the plan has to be implemented, it has to be evaluated, and the plan has to be revised. So once you give something, then that has to be implemented, that has to be evaluated, and that has to be revised. Or there is a DAR format, the data action and the response format. Or what is FARM? You must be knowing, like SOAP, FARM, we interchangeably use these terms and the formats: finding, assessment, resolution, and monitoring, right? So these are the formats. The structure of the care plan is used by, these are these formats, right? When observing the recent presentations by the fourth year, fifth year people on SOAP, on FARM, or expanded FARM or SOAP formats, we have to understand in principle what is our job, rather than just putting things into format. We are not document writers. We are not document writers to just write what is available in the record and just leave, right? So when our idea is to provide a customized plan for the patient, that plan may include a diet, that plan may include a different dosage form, the plan may include an solution to the existing problem, or prevent a future problem. So all the drug related problems we need to bring into the in the on the paper. Now, suppose if we say particular drug A would have a side effect, so I recommended that that drug can be stopped and the other drug can be given from the same class. Now, have we found out what are the side effects of that drug which we are recommending? Why should this be recommended? Is it even required? See, all therapy is based on risk versus benefit basis. Ultimately, the aim is to provide the patient with a customized care or a better outcome based on your interventions. Some people write in their slides, Form D intervention. My recommendation was this. As a Form D, I recommended this. See, Form D, B Form, M Form, all these things are immaterial. You are a clinical pharmacist. So, what is to be present in you is, first is common sense, the second is presence of mind, and your attitude, skills, and knowledge do matter. Now, if you go as a person to find out a problem, no, finding problem is different. going with solutions is different. When you go with a solution, you have already found a problem, but you are not discussing about the problem, but you are offering a solution. Now, in a problematic condition, everybody wants a solution. So, who they will search for is a person who provides solution, and not a person who comes when finding out the problem. See, we have to understand, as a newcomer into the medical team, who is going to bridge between the doctor, the various medical paramedical team and the patient, we should always go as, solution providers. Now, if not rosuvastatin, if use propose atorvastatin, why not rosuvastatin? What is the advantage of having atorvastatin? Now, as statins, if they have a class effect and you don't want statins to be used, then what drug and why? And that too, you are not saying, your evidences are going to say. I see most of even the fifth year, fourth year students where we go for examinations recently, we could find that, they take references from Google, from healthline.com, from NDTV. See, this kind of references are not to be mentioned by the pharmacist. Right? Please understand, when you're doing an FARM, SOAP, working with a doctor, do you rely on something which is present in a Google or a Wikipedia kind of web information, which goes uncensored, uncontrolled, or which is not monitored? Now, you are not a common man. Please try to behave like a pharmacist. And the bhava of a pharmacist has to be present in you from the third year or from the fourth year. You have to act like a pharmacist with all those responsibilities. Right? If it is my brother, if it is my mother, my sister, so see, we say we should not attach emotions. We need not attach. But the problem is we are overly professional, and we are not even professional by calling us as professionals. Right? Please understand, when we jump into water, we can learn swimming. We cannot learn swimming by seeing in YouTube and trying to swim on the ground. Right? You will have to jump into water, and when you jump into water, you will literally swim. Right? So the same way, when you present a SOAP, when you present an FARM, when you present whatever formats you are using to document, please try to understand the principle that we are not there to just find mistakes, highlight, and give some suggestions and run away. That is what happens in the expanded SOAP format. Right? So, or implement, then again monitor, and then revise. Implement, evaluate, and revise. So that's what SOAP, then implement it, then evaluate it, then revise it. Now, most of the times we see that, there is what is the outcome of that intervention, the pharmacist intervention? What is the outcome? The outcome was communicated to the medical team, the outcome was communicated to the doctor, the outcome was implemented, the outcome in the recommendation, the intervention, or the pharmacist intervention, was that implemented? Was that implemented partially? Was that implemented fully? Was that rejected? Why rejected? Why? See, whatever we recommend need not be ultimately accepted. We are not the only life-saving heroes. We are working in a team. Please have that mentality that we are working in a team, and we are not here to find out the mistakes of. No, just finding the mistakes is one part. That finding the mistakes, coming out with solutions, understanding the mistakes, why it has happened, avoiding those mistakes in future, preventing them in future, and in this patient, how to alleviate that. All these things have to come. Then it is a series. It is a cascading thing, that you have found out a mistake. You have found out a mistake before it had an impact. Then you have rectified it. You have communicated it. You have made a plan so that this mistake will not happen again. Right? That is common sense, that is presence of mind, that is what is, you ethics, professional ethics. Right? So you find that there is a problem, the more you do like this, you are going to gain more experience, and then your clinical eye is going to improve. Right? So just suggesting a change, just suggesting a lab test, just suggesting something because something is a problem today. See, any therapy is based on risk versus benefit basis. Right? So there, which is a safe drug? Is there a drug which is so safe, which has got no side effects? Can you name one drug? Forget about the nutraceuticals. Even the nutraceuticals, the Ayurvedics, the homeopathics, the natural, anything. You see, everything is a package. If you have a positive, you will always have a negative, right? So there is going to be a positive side of the coin, the negative side of the coin. Both of them are going to be there. You cannot expect only the positives to happen and the negatives should not happen. Any chemical which is getting into the body is going to have positive as well as the negative side effect. So whatever happens, whatever therapy a doctor prescribes, or an action that is being undertaken in a hospital, in an ICU, in an emergency ward, will always have the equation is risk versus benefit. The benefit now, cholestyramine sodium, both of these were discontinued in 1982. Now they are back. Now they are back since last 5 to 6 years. Why? Because they are not, the antibacterials are not available today. So we have to bring back those antimicrobials which were discontinued from the market in 1982. Now, what were their side effects? Ototoxicity and nephrotoxicity. Now, to save a life, you can compromise on the ototoxicity. You can take ototoxicity. To save a life, you can compromise on one kidney's health. To save a life, you have to ampute the leg. So as a pharmacist, they are amputing the leg. How the person will walk? Don't take it emotionally. Now, what are the possible outcomes? What are the alternatives that are possible? You will also have to discuss with the doctor. Now, just presenting an SOAP, subjective objective assessment plan, then what has happened? Your plan, the plan was implemented, the plan was not implemented. What were the problem in the implementation? How did you evaluate whether it was implemented or not? Whether after implementation there was a problem in the plan that you have proposed? Are you foolproof? You have come with all, He-Man, Superman kind of things that you are going to save the patient, and the doctor is not interested in the patient. The attitude has to change. The attitude, especially for PharmD, has to change. Now we say, I need recognition. There needs to be clinical pharmacists in NABH certified hospitals, demanding. I want respect. I want respect. I need to be recognized. I need to be recognized. Please add value. Talk about value addition. Talk about saving life. Talk about decreasing drug related problems. Talk about decreasing drug interactions. Talk about implementing a good care plan in the hospital where you are employed. Talk about doing some value addition to the entire medical team or the healthcare team that which you are a part of. Just finding out a problem, you keep on finding problems in everyone, mistakes in everyone. You think you will be able to survive in a team? We have to find out the mistake, but we have to communicate the solutions. Now, finding out the mistake, communicating the mistake, proving that I am superior to you, it's not going to work in a team. And that is not the principle of PharmD. That is not the vision with which PharmD or clinical pharmacist has been appointed in the hospital, right? So there are doctors who have been taking care of all these things without you, the clinical pharmacists, in the starting stages. Now we have got nurses, we have got physiotherapists, we have got dentists, we have got nutritionists, we have got all kinds of specialities to support us. And we have to act as a manager of all these things with the healthcare team, and bridging them to the bridging them to the patient. And our aim is not to find mistakes, but to give solutions. We may be wrong. We are not in isolation. We have to work with the team, and we have to convince the doctor if we are sure that what we are talking is right. And we are not going to talk, our evidences are going to talk. And please understand, we in the fourth year we study, third year we study, in fifth year we study certain subjects. Now, PharmD is, with the certificate, you can do nothing. It is a bhava. It is a clinical eye, and that clinical eye can be developed only when you experience seeing more cases, presenting more cases. And after taking all the data document, we see that BMI is not there. Now, how did you say that this drug is inappropriate without even BMI being recorded in your report? You are documenting something. The documentation has to be proper, and the dosages are all calculated in body weight. And we say, we document, we are here to correct, and we make the mistakes. Have you not seen pharmacists making mistakes? Dispensing some medicine where something else was written, the indication was different, and the women's health drug was given in place of oncology drug, and oncology drug was given in place of women's health drug, because the names were same and all the we should have presence of mind first. Now, what is the diagnosis? One has to go through and then find out if there is a problem. Please ask, then get clarity, then come back. It is about health, right? So we have to understand all these things. And in fact, we should beyond SOAP, we should talk about implementation, evaluation, revision, and then what are the other things, whether it was partially accepted, fully accepted, not accepted, why not accepted. See, the mentality that whatever I say is right and whatever is happening is wrong is not going to work, number one. Number two, if at all there is a mistake, and I have also found out certain things, I have to go and talk with the team. The team has to be understanding what I say, and there may be a mistake from my side also, right? So please be open, and as a team you are here to provide customized services to the patient. Your aim is not finding out mistakes, at least in fifth year, at least in the 6 years in your internship and other things. Please don't go with an attitude of just executing certain things. I have found out drug interaction, I found out that, I found out this. And people use the online drug checking, interaction checkers and other things which are available in open sites. You all have got softwares, you all have got evidence based medicine is something which we are missing. I am not saying, as Ananta Zainam, I am not saying, you are not saying, as person A, as person B. You are giving them the evidences and saying that these have been documented. And so I feel that this is what is the thing. And so I recommend this. A lab test is recommended, and an indication is unattended because of this, because of this, because of the reasons have to be very clear. It is not you personally doing it. It is the data, it is the knowledge, it is the science, it is the experience, it is the documents, it is the evidences that are behind all these things, which are telling you, or which are suggesting to you, or which you rely on, or they back you up in your suggestion. And that's what a Pharm note, a finding assessment resolution monitoring note, or SOAP, subjective objective assessment plan. And after that, please come to implementation, evaluation, revision of your plan, right? So the revision of the plan that was given already, my suggestion, in my suggestion something was right, something was wrong, I have to suggest it was not implemented, then again it was revised, and then we implemented the right plan. So that should be the mentality of PharmD or a clinical pharmacist, rather than saying that PharmD recommendations, PharmD interventions, PharmD corrections. Please don't hang on to your position, hang on to your designation. Designations might go, positions might go, but responsibility, if you are able to adhere to your responsibilities and the roles that are given in the hospital towards the patient, and in providing customized healthcare, we will not make all these mistakes. The basic things. What is a DRP? Drug related problem. Drug related problem can be anything. The problem may be with the patient, the problem may be with the drug, the problem may be with the route, the problem may be with the doctor, the problem may be in the hospital, the problem may be in the dosage form, the problem may be in the flavor, the problem may be in the additive, the problem may be in the pack, the problem may be with the nurse, the problem may be with the attender, the problem may be with anyone in this, in the scenario or in the circumstance. So all these are classified under drug related problems as per PCNE classification, Pharmaceutical Care Network of Europe classification. You can see what are all the problems. Overall, they are classified. The drug related problems are classified. Please understand all these drug related problems and study PCNE DRP, study evidence based medicine, and then even in your fifth year, when you are talking about your project, I would not call it a project, it is a research. And when you are talking about the research, please, you will have to understand biostatistics and research methodology. And people are not involving a statistician at all in the starting of a study. Then there is something called epidemiology, there is something called, and people are not interested, the PharmD graduates are not interested in publishing it. Now, what is the meaning of doing a research without publishing it? Now you do a literature review, you get lots of evidences from your past, and you are taking it as the base for your research, and you are not publishing it. Now your knowledge stops over there, right? So you will, a research that is not published is not worth doing it. So please don't do a research. You may call it a project, it's not a project. Now, From second year, third year, fourth year, if we have done 3 or 4 studies based on community pharmacy, hospital pharmacy, clinical pharmacy, and all those things, then the fifth year project is going to be worthwhile. Otherwise, we will be talking of something in an observation study, a knowledge attitude practices study, an observation of the drug interactions, the classification of drug interactions in a particular unit. All these things, in the fifth year, I don't think we should talk about all those things. After studying evidence based medicines, research methodology, biostatistics, and all these things, right? So, the practical usage of studying all these subjects from year 2, 3, 4, and all, pharmacoeconomic studies can be done, which is very important for the people to understand. So please understand the principle behind giving all this. Just doing a project or a research for submitting it to the university, PCI, it's not going to help. We have to have we have to involve ourselves. We should be passionate about the job. Then respect will come in search for us. We have to do something different and add value to the team that we are present in, instead of just finding out mistake, giving some recommendation. That drug was changed, this drug was changed, that was not given, the dose was different, it was documented wrong by the nurse, this I did, that I did. No, that is also a part of your job, but we will have to understand how to prevent it from happening again. Have I evaluated, what did I implement? Was that implemented first, partially, fully, or not implemented? What is the reason? And after evaluation, whether it has given results or not. If it has not given results, did I go back to the old thing? Why did I fail? All these things have to be mentioned in your SOAP format. You can call it as SOAP IER format, in fact, implement, evaluate, and revise, right? So we will have to understand that it should be an expanded SOAP format, otherwise monitoring and education. But in expanded SOAP format, we just talk about monitoring and education. But when we are here in the SOAP other format, when we are talking about SOAP IER, it is implement, evaluate, and monitor, and then again revise. Implement, evaluate, and revise. So that is what is very important. And if we are not passionate, we cannot be successful as doctor of pharmacy. Just putting in a doctor in front of your name, going for a dispensing job, is not going to help us. Please don't spoil your parents money, which they shed their blood as sweat, and they give you 6 years to study. From second year, third year, fourth year, or from the first year, every class, every day, every subject, every topic is important. If you are passionate, take Form D as your passion. If you are not passionate, please don't join the course just for, if you have joined the course just for the sake of adding a doctor. And MBBS doctors are not successful. Are all MBBS doctors successful? Are all MDs successful? Are all surgeons successful? No. You should have a passion behind whatever you want to achieve or whatever you want to do, and that passion should not get into ego as onto your head. That, I have done my Pharm D, I'm going to advise. Don't expect AC chambers and laptops and, try to put a doctor in front of you. You will be making fun of yourselves with such kind of salutations, doctor, this, that, and all those things, and you don't know even the basics, or you could not give a suggestion so that, the therapy can be done well. So please be passionate. Please fill in all the data in the documentation process. Don't underestimate the usage of BMI. Think, it is not a project, it is going to be a research. And please implement, evaluate, and revise after your SOAP is done. Please add implement, evaluate, and revision. You may also be wrong. And so you need to discuss with the team whether your recommendations are accepted or not. If accepted, why? If not accepted, why? The reasons and all those things, you will have to understand this, and you will have to implement this. Then your rewards will follow you. Otherwise, you will be keeping on demanding or begging for respect. Thanks. Jai Hind.